Hi ladies, I am Barbara and I am your menopause drama mama. If you're new to my channel, I welcome you. I am just fascinated with the human body. Ever since going through menopause, and I went through quite a bit of hell, probably the first 7 years of menopause until I finally got a doctor that would listen to me. But I am just fascinated now with the human body and how it literally tells you what's going on. You just have to look for those signs, because sometimes maybe you're not feeling the pain or something going on, but there are signs showing on the outside of your body that something is wrong on the inside of the body, and that's something that you would need to look at to try and correct. And whether it may be, hormonal imbalance or a deficiency in some vitamin or something, but our bodies definitely will tell us something is going on. And I looked into what it is about our fingernails because, I have the little lines that go straight across my fingers. And, I never had that before. And so I was just wondering, why are they showing up? And, so then I decided I'm going to do a video on this because there are so many things that show up in our fingernails that tell us about our health. And I know there was this one woman that my husband had worked with, and she had this black spot on her thumbnail, I believe it was. And I was friends with her also on Facebook. And she had gone to the doctor, many different doctors. And she wanted to know, what is this black spot on my fingernail? It turned out, after many different doctors that she went to see because nobody knew what it was, it ended up being cancer, and she later passed away, which, was really sad because no one helped her. It took her a very long time to find a doctor that actually knew that that was cancer. So that is the fascination that I have right now with fingernails. So this video is all about that, and I'm going to give you some possible things that may be going on. If you notice things maybe on your fingernails that you can check out. Like number one, if your nails are brittle, if they are splitting, like you could have splitting nails at the tip of the nail and the top layer just comes off. The possible causes for that are declining estrogen in your body. And I'm talking about the ovaries making your estrogen, not the other. There's a couple different organs that make estrogen, but that's just kind of like the survival estrogen, not the protecting estrogen that your ovaries made for you before menopause. Other reasons for the brittle and splitting nails is dehydrated, very low protein intake, iron deficiency, and thyroid issues. Now, I know for many, many years I have had gut problems. I finally have figured out a way that I start absorbing more nutrients in my body, because I know for many, many years there are things that did not change, that I was taking the correct supplements, minerals, vitamins, eating better, kicking out sugar, but things still didn't correct themselves fully. And I was wondering why. And I didn't at the time connect that it was my gut with my body. So if you are not, your gut health is not correct, you cannot absorb the correct nutrients that you need into your body. And I'm just going to say this, since I have started taking this, I have no gut issues anymore. No gas, no bloating, no cramping, no holding my stomach all day long and days on end because, I had maybe too much dairy or something, and it just tore apart my stomach. Well, I realized that my gut was not healthy at all, and I was not absorbing the nutrients my body needed. And I have to say, last night I made it was a copycat recipe from Olive Garden for their steak gorgonzola, and that recipe uses a lot of heavy cream, half and half, a couple different cheeses, the gorgonzola, the Parmesan. I took this before I had dinner, and I made a lobster bisque soup, which is tons of onions, carrots, celery, and more heavy cream. I had zero gut issues after eating. I didn't have any gas. I had no bloating. So I am telling you, if your gut is not in good health, you can't absorb the things that you're taking. So I'm just putting that out there for you. If you're having issues with gas, bloating, your stomach bothering you all the time, maybe you're poop floating, I would try this, because if you are taking supplements, it's most likely that you are not absorbing them into your system. So I'm going to move on with my video right now. But if you notice, like the peeling layers, cracks at the nail tips, like I said right here, or nails breaking easily, that could very well be the declining estrogen, dehydration, low protein intake, iron deficiency, or a thyroid issue. Number 2, and that is what I had an issue with, was the vertical, like ridges on my nails. I can't stand the look of them because I used to always have very long nails and wore nail polish, and my hands always looked really nice, but I don't like these vertical ridges. Well, what is vertical ridges? They are long ridges that stem from right at the cuticle tip all the way to the end of your nails. The normal causes of these would be aging, reduced collagen production, which I know that happens after menopause, and I went through that because I was not on my BHRT, bioidentical hormone replacement therapy, for the first 5 years after postmenopause. So I had that 30% decline in my collagen, reduced circulation, and nutrient deficiencies can cause the vertical ridges. And since I know that my gut health has been way off balance for many, many, many years, I was not absorbing the things that I was taking. So these issues just kept continuing, and they show up on my nails. So I'm hoping now that I just got this corrected just 2 weeks ago now, I will start seeing some better changes in my body. Let's see. Also, what those ridges can be is a vitamin B deficiency, iron deficiency, and a low protein intake. So if you notice mild ridging, those are some of the reasons why it could be happening for you. If you have spoon-shaped nails, and I have this all listed on what the nails look like, just so you can follow along. If you have spoon-shaped nails, the possible causes are iron deficiency, a poor absorption of nutrients, and chronic digestive problems. So if your nail appears to curve upward and hold like a little drop of water on your nail, then that is what's considered to be spoon-shaped. And I would look into correcting your gut then, because that is number one thing that you need to correct in order then for you to absorb those nutrients that you're not getting into your system. If you notice white spots and white lines on your nails, that could have been just a minor trauma to your nail, a zinc deficiency, or a protein deficiency, which is less common because normally when a person gets like a cold, you will see like a white spot a few weeks afterwards, and that was a signal that your body was deficient in zinc at that time when you ended up getting a cold. So the next one is if your nails are very pale, that is of iron deficiency anemia, low B12, or a chronic illness, and that can accommodate and also, let's say, contribute to fatigue, shortness of breath, or feeling cold. The next one is if you have thickened yellow nails. That's usually a fungal infection, a sign of diabetes, poor circulation, and aging. And that is very common after the age of 50. If you have slow nail growth, that can be a sign of hypothyroidism, low protein intake, reduced circulation, and a lower estrogen level. If you have horizontal grooves across your nails, those are called Bowes lines, and that is more of something that you should be aware of because this can signal severe illness, major stress on your body, surgery, high fever, and significant nutritional deficiencies. So those would be, like I said, deep grooves going across your nails. If you have clubbing, this is something rare, but it's very important, where your fingertips are enlarged and your nails are curved downward. That can be associated with lung disease, heart disease, and other serious medical conditions that you need to get checked out. And this is something where you, like if that is happening where you have that clubbing, that's a significant problem in your body. And I would literally run to a doctor to find out what is going on with you. Number 10 in my symptoms or signs on your nails is if they are wavy or dented. That can be from dryness through menopause, iron deficiency, zinc deficiency, psoriasis, thyroid disorder, and repetitive trauma to your nail matrix. And if you are having a lot of nail changes and it's occurring with fatigue, hair thinning, dry skin, digestive issues, that you can have some tests done that you can ask your doctor for, like the iron panel, which will give you the ferritin, the iron saturation. Ask for a complete blood count, a CBC. Also, they can test for your B12, your zinc, vitamin D, thyroid panel, which the TSH, free T4, free T3, comprehensive metabolic panel, and a protein albumin. I knew that word. I just couldn't process it correctly real quick in my brain. And those are typically in a yearly blood test, and that's what I make sure I make my doctor give me every year. I just want a full blood panel, a lipid panel, to make sure where all my numbers are in my body. So, most common contributors for nail changes are low estrogen, low collagen production, reduced protein intake, iron deficiency, thyroid dysfunction, zinc deficiency, and chronic dehydration. So, ladies, that's this video in a nutshell on things that your nails can be telling you about your health. And I hope you enjoyed my video. And I hope that the sun is shining upon you today. You're having a fantastic day wherever you are in this world. Always sending high vibrations and many blessings your way. I will talk to you very, very soon in my next video. Please click the like button if you did like it, and subscribe to my channel if you haven't yet, because it costs you nothing, but you get a lot of information about menopause. All right, love you ladies. Have a fantastic day. Bye-bye.